Hello everyone, welcome back to our channel Decode MD. I'm your host Dr Abhilasha Nanadikar, and today we have a very special guest with us for guiding us from choosing out of the traditional paths in pharmacology. So joining us today is Dr Manthan Mehta, an accomplished physician and pharmacologist who has seamlessly blended medicine, technology and entrepreneurship, from serving as a chief medical officer at IXA.ai to leading innovations at Fitterfly and Alchem Laboratories. His journey stands as an inspiration for anyone seeking to build a career beyond conventional. Hello everyone. Here we have Dr. Manthan Mehta with us today. Welcome, sir. How are you?
I'm good, Abhilasha. How are you doing?
I'm good too. Looking forward for this podcast, actually, how it will go. Everybody is viewing for the inspiration and path to be followed later after pharmacology.
I'll try to do my best. I don't promise or assure of inspiration, but I do promise that I'll share real, honest stories and examples about my journey, which may or may not help others. So let's see how unfolds.
Frankly speaking, you are an inspiration to a lot of people among us when we are in our pharmacology residency. So you know, right? It's a little difficult to not know the path, like how to go forward, and people like you, our seniors in the field, are there who guide us through it. Even from distance, when we look at them, they are an inspiration to us. So you are one already.
Thank you.
I'll just dive into the questions. The first question that pops up into my head. How was your residency exactly? How was it during your residential time that this inspiration came to you? You went forward with it.
Sure. So, interestingly, the first time I actually spoke to a large crowd of MD Pharmacology students just after passing out was a TED style talk, and takes me back by many years now, 7 years to be precise, and that's where I started the story, because it was a TED talk. It started with that story that I very happily entered my first day of residency only to find a lot of people, dejected, bored, and talking about how are you going to while away your time in residency and what you're going to do. But fortunately for me, I think we did not have all these podcasts and this opportunity to actually connect and listen to seniors. So I was a serial LinkedIn stalker, and I connected with all the possible people I could, leveraged few of my network, and actually spoke to a lot of people. And one person who particularly inspired me was, he mentioned that you are two ways you can deal with your residency. One is you can enjoy those 3 years and make a lot of fun, complete a lot of series, enjoy your time while you are still a student. Or two is do so many things that you are so occupied that you really don't have time to do many other things. And I think I chose the latter, and that's what changed a lot of things for me. I took up various small projects within the department, few externally as well, to groom myself, to learn, to understand how this world works, right? How the corporate world works, or how research works, and dabbled into a bit of each of it, right? Did research projects that helped me get an ICMR award, helped me go to the US on a student poster award, helped me win the Novartis Biocamp, and activities like those, contests and quizzes, and also some freelancing work in medical writing, medical communications, and digital health startups. So all of that, I think, is bits and pieces of those which I use today, and which has of course shaped my career as well. So that's how my residency has been. It's been probably a little different than a large majority of people who are most of the time worrying that what can I do that will propel my career after residency, or thinking whether I chose the right branch or I did not. I think I took a different path and tried to make the most of it, of whatever opportunities were available at the time.
Very true and very fascinating, actually. The thing is that most of the residents, maybe during your times also, and a lot of them now also, when we talk to them, what we get to know from them is most of them are choosing a career either in teaching or have restricted themselves to a industrial job, right? For a longer period of, if you ask them a span of 5 or 6 years at least, it's particularly based only on industrial roles or teaching roles most of the times. But then for you, was there any one particular inspiration that got you into it and told you just need to explore more into health tech? There is lot of avenues in health tech and it's a little step ahead. What was that point?
So, see, I'll be quite honest. It wasn't the first thing that I thought, right? Like most of you, and even decades ago when people entered, they knew how branches evolve and what roles will be available for them. Health tech, when I was doing residency, that's again like a decade ago. So it wasn't what it is today, right? I think a lot of catalytic activities happened because of COVID, and a lot of tech evolved and changed a bit. The last couple of years again has been the AI revolution, and things like these did not exist. But I think small pieces of what worked for me, or thought that this could be an avenue, was that I was consulting for certain startups, yeah, in small capacities. Earlier I was writing for a few of them, and then it evolved into a consulting kind of a capacity where I was helping them design studies, design research protocols for WhatsApp based reversal programs, etc., which was my kind of first exposure into the field. However, the places I was working for, they had their own startup dilemmas that they go through, and I never considered those things as full-time opportunities to begin with in my career. And later with time, I think when I was in traditional roles is where I started exploring digital even more, and my working in that different roles or different projects which revolved around the digital healthcare landscape helped me probably move into those domains. But within residency, if you say, back in the day, there wasn't much except this very unique exposure that I got consulting for a startup in the PCOS space, and designing research papers and protocols and studies for them. But today, I think it's very different. I mean, today residents have that opportunity to do things as well as understand that these can be career options and landscapes, because it's evolving, right? A lot is evolving, and so is our role, and that will change today. But if you ask me, I did not have something that I want to do this only at that time, but I was dabbling into all. See, I had a very simple principle in my residency that if an opportunity comes, or if I'm looking for any opportunity, I will say yes first, and I'll figure out how to do it later. So maybe that's what helped.
These are the words from the wiser. I hope all of our listeners and viewers know that try and test everything.
Yeah.
When you have time, try and test everything. What works for you, then is the time you will know.
Correct.
Am I right?
Yeah, very true, very true.
You were, and we are right now in a residency where you get to try and test everything. Like, I have not yet gone into the part of intersection between medicine and technology per se.
Hmm.
So how did you find yourself so differently between it?
Yeah,
Yeah, I think you would.
I think very torn into it. I, in fact, did not give the maths entrance in my MBBS days because I did not want to do anything with technology or engineering.
Lot of us are that.
Yeah, right. And my late mother, she was insistent that you give it, and she's like, you're going to have a flourishing career. Engineering MBA was like the coolest thing to do, I think, back in the day. So she was like, it's all settled, why do you want to be the first doctor in the family and slog it all off? But
Oh my God.
life is a full circle, I think, and then it brought me to this loggerheads with technology at the forefront. So very, very different in many ways. In many ways is understanding how people who build the technology, how they think versus how we think from a clinical application perspective. So lots of new learnings, but interesting because I think I didn't have to go and build it myself or do the tech bit myself. But what I understood out of that is that you need to understand how it works. Because I think when I joined, technology startups, I figured that I used to think that technology can solve a lot of things, and they used to think that in medicine, giving any medication can solve everything. So we had to both come, somewhere in the between
At the same ground.
and understand each other that yeah, medicine is not magic, it's science. And even I had to understand that yeah, technology cannot do anything and everything I wish for, it's not a genie. And
True.
there I figured that if you understand how it works is only when you will know what will go right, what will go wrong, and what is valued as a clinical person or as a medical person within technology or health tech is your way of interpreting it, your way of gathering insights from it, and your way of catching that, oh, technology is going wrong here. So, my product people just tell me, test it, break it, try to break the system, ask it the most weird questions, put in what the worst patient will do, and then let's see how it works. So I think I enjoyed, of course, doing that. But that's where I think we come with technology. So a lot of people also ask me that, do you need formal courses and do you need things? Today with AI, there is no code technology everywhere. AI will make the code and give it to you. So you really don't need to get into the nitty gritties. They don't want another engineer, of course. They have plenty of them. I think what they need is somebody with a
Very
clinical
true.
acumen who understands technology, the right, wrong, and its limitations.
Correct. Very, very finely said, actually. I still have this question, like while transitioning from like our MBBS and interns days are usually like full blown clinical, like आज तो हम जाके surgery ही करेंगे किसी की तो वाला phase, and then comes pharmacology. It's like a mid ground between the clinical phase and non-clinical phase, and then what you are doing. You have a clinical base though, but then it's a lot of transition,
Yeah.
lot of mental and also putting in your views transition. So how did you manage that? You must have faced a lot of problems, you must have faced some setbacks. If you had those? I would like to put if there, if you did, how do you put it forward for us today?
I think, see, the core thing is a mindset shift, and when I decided to take up the branch, also, all seniors told me one thing that, if you have to be willing to, let go of the white coat and put on a suit for presentations, and probably
Lot of
put
us
off,
have heard that.
yeah, put off the stethoscope and put on a tie, and now I think put on a mic. So, but the way it works is a mindset shift, and it is difficult at every step when you take it up, when you even every day when you probably explain or justify to people actually what do you do, and then within the career also, because if you take a non-traditional path, so first is your non-traditional path of going the non-clinical route, then is within the
Yeah, yeah, yeah.
non-clinical route take a non-traditional path of not doing academia research and traditional industry to then venture into those roles. uh,
Still, industry comes in the last line, I think. Still,
yeah.
industry comes in the last. The primary thing that a pharmacologist should do is teaching.
Yeah.
That's what
So
I've very consistently heard. Like, a lot of us must have heard too. Teaching is the
yeah,
primary thing you should be doing.
I think that's how they designed the whole place, and that's what you see in residency all the time, right? You only see them as professors. You don't have people from different domains coming and talking to you, or you hearing their stories that you feel
Yeah.
that things can be done differently. So I think what you guys are doing this as a separate initiative is really great, because this gives a lot of people perspective, and that comes from real life stories and more candid conversations.
True,
So
true, true,
the
true.
mindset shift, I think, is very very critical, and you do face challenges. I think when I was put into the domain, I was actually wondering, it was the first time in corporate, a lot of people talk about imposter syndrome, that you probably at times think you're not great at your job when you actually are, but you suddenly feel, or you feel for some varied reasons that you're not. And I think I felt that when I entered the tech space, thinking that, hey, I don't know what to do. I have been given a leadership position. I don't have people to really ask. I can't go and ask the CEO, because it'll be like, how dumb. Like, I took a bet on you to do this, at a young age, and now you're coming and asking me such silly things. So like, figure out everything on your own. And AI was quite nascent, okay, to figure out things that it does today. So it went very challenging, because the expectations of it's like, I felt the whole world is looking at me like, what is this person going to do now? The startup is looking at me like, oh my god, these people have got another doctor, and now he's going to develop an entire heart health program, and do things with it. Like, how are we going to do it? And I remember the first time I created something, and it was more or less based on inputs that came from other teams and what existing programs were running. And my CEO just asked me, told me in a very nice way, saying, we've brought you to make a difference and bring your flavor to it. You don't have to get into the mold. He's like, I would have got another 45-year-old seasoned player if I wanted them to just put things in a mold. He's like, we've got you for out of the box thinking. Why are you putting yourself in that box? And then I was like, okay, let me, now I can do that. I want to do it out of the box, but I can do. So very different. After that, moved to entrepreneurship. Again, more and more challenging, because now you have to figure out everything yourself, from setting up a Google workspace to create a company email, to developing your own website, to social media handling, and things even I thought I couldn't do, which I probably did well, at least in my opinion. But the mindset there was again very, very different, and you're constantly in that bridge of working in corporate, where everything is so structured, so organized, everything is systematic, to complete chaos. Like, complete chaos. I remember we had days when we had demo scheduled for the afternoon, and morning we realized we've run out of credits to host the cloud server. Like, how are we going to do it? So challenges like these which you would have never foreseen, and that's when I figured that whatever challenges there's to see in academia, see in corporate, now looked very small to me, saying, oh, why was I even ranting about it or getting stressed about it? I have such big problems to deal with, that I have been burning money, I'm not getting revenue, I'm probably not getting any funding, and I'm facing myself there, and I'm wondering. I said, I used to get scared of MD Viva. That how am I going to answer questions for half an hour or 1 hour straight, and then here I'm like, every investor is grilling me as if I'm going to ask them a limb and a kidney. So but it's all on the mindset. I think that's what's evolved, and these are not things you learn from books. I tried to read a lot of books on entrepreneurial mindset, 0 to 1, startup journeys, leadership, and tons of other things, but I feel nothing teaches you what real life experience teaches you, or stories that you hear from real people teach you.
True. Very, very true. Everything. We can just relate to it. Halfway in the residency, still we can relate.
I'm glad you can.
Like you mentioned it before, that you technically don't have to learn a full-blown set of coding skills for going through all of this. For reaching out to a particular place, you don't have to learn how to code. You have AI for that.
Right.
But still, there could be some set of skills, even your day-to-day behavior and the way you talk, the way you take up things, the way you go through a given project. What kind of skill did you harness into yourself that helped you go through all of it well? What was it that helped you more?
Yeah, I think I'll appreciate the question, because most of the times on platforms like these, the most common question people ask, either on a 1:many like this, or sometimes a 1:1, is what course should I do, what certificate should I get, and that will give me a role like yours, or or things, or a career journey like yours. But I think
Yeah.
what you asked is more pertinent and more relevant. See, we all have our skills, right? And I am a very strong proponent of the strength finder philosophy, that we should play on
Huh.
our strengths more, rather than only focusing on improving our weaknesses. So we need to play on our strengths, right? And like you said, from a day-to-day perspective, I think most critical are soft skills, which we fail to understand. And I don't blame doctors for that. Universities have put in curriculums for soft skills and patient communication and empathy, but that doesn't happen through short lectures or courses, right? It's an acquired taste, probably like a matcha, that you don't probably have the taste right at the beginning. So you need soft skills at every stage, and that includes the way you talk, the way you message, the way you write an email, the way you break down things in terms of explaining. A major drawback that a lot of medicos face is that we are always surrounded by medicos or paramedical staff,
Yeah,
and
yeah.
because of that, your language, your communication, everything is still technical. You do
Hmm.
not get into the other person's shoes, because for you the other person's also a medical person. So you have never had the need to, break down
Break it
things
down.
or break down concepts and understand. Two, because we are always surrounded by medicos, our conversations are also around medical stuff only. We are not able to have, short conversations or small talk about the weather and finance and current affairs with a lot of non-medical people.
A lot of us
Our
don't know also. It's not about we don't know to talk. There are a lot of us who don't know what it is.
yeah, I wanted to be politically correct and not say that we don't
I mean, it's
know.
blunt, but it's true. Like, lot of us, if you have to sit and talk about finance, about weather, about foreign affairs or anything like that, or even current affairs of your own country, none of us know things.
Yeah, yeah.
Like
People
most
really
of us don't know
people
things.
don't know. I'll tell you examples of, I used to make reels in my pastime, for health topics or something that comes interesting around me. And I had so many of my clinical friends asking me, saying, how do you make a reel? How can you edit? Give me software, give me this, give me that. So people really, I know, are not very, very aware. So you broaden your horizon, and that comes through conversations, through networking, and look beyond the medical space. I think that is
Yeah.
one day-to-day skill you need to really understand and learn, that you need to learn how to talk to non-medical people. Uh, who are not patients, okay? So otherwise
Get
they'll say
out of
you
the
only talk
clinics,
to
please. Is
non-medical
the
people.
get out of the clinics is the conclusion for this question, guys.
Absolutely, absolutely. So that's of course one core skill you need to learn. Two is you need to really understand that every small thing becomes a stepping stone in your career, in your professional as well as your personal life, in terms of gaining experiences. Do not shy away from things. As medicos, we like being perpetually busy, and we want to stay in that bubble where we want to act busy and stay busy, but not really understand what productivity is. A lot of them feel that reading business books or reading self-help books or those kind of books are such a waste. I would rather read something more interesting on a medical update. But you are supposed to groom yourself as an individual if you want to do all of those things. And three, we should stop running behind degrees and certificates. If you are not doing a clinical practice in the 1990s where you put a board and then you put random 20 alphabets below your name, so that makes you intelligent, that this is a good doctor because he or she has so many degrees, I think those days are gone. Our obsession for
Very true.
collection of
Very
certificates
true.
and degrees is really too much. Okay, I, I
It's
have
way
them
beyond
I have them
necessity
filled
at
here in the
times.
cabinet here, which I have never looked at. Okay, so or never taken them anywhere to flaunt or show
At
off.
the end of the day, it is going to boil down to quality.
Correct,
How
absolutely,
many degrees you're adding in is not going to help you.
very true, very true. So yeah, long answer, but yeah, that's where we are.
Yeah. So then skills that you told us, like, talk properly. Be okay with talking with a non-medico and non-patient person. And also get into your heads that gain soft skills more. not your degrees more. Yeah. Go learn the core basically of any subject you're
Real
learning.
life and
Ha,
learn real life skills. You know life
real
saving
life skills.
skills. We have 2 degrees to tell us that we know how to save lives, but you need to learn life
Yeah.
skills. We don't
You
have that.
need to learn life skills and also the jugards of life skills, I think. You should know the jugad at the end of the day. How
Very
to get it done, how to
yeah,
get a work done, and how to get it done right.
perfect,
And within right time.
perfect.
Also. Time is very
Abhilasha,
important.
very soon you have to be on the other side. I think you're
I am
already
learning
quite
from the best people. I'm talking to people. Why do you think we are here? We are learning from you people. We are there for that.
perfect.
And we want
Perfect.
more people like us to be generated from inspirations and from just listening to our talk also they might be very much help with this. Because a lot
Sure.
of times nobody gets to talk and get to know things what is actually going on beyond our residency.
Sure.
We are very thankful that you people give us so much time.
We're glad.
Moving forward with the next question, I'll not bore you with what I talk. Sorry.
No, no, it's fine.
So you
You
are actually in the forefront of healthcare, right? Like you saw the transition from just clinic-based or doctor-patient relations, then a little on to the digital platform. Now the new, not exactly newer, AI has been there since a big while, but it has become a big thing right now because everyone got access to it on a very easy basis.
right.
But then AI, looking at the access, it is growing. Where do you think it will lie in our healthcare system slowly in the coming forward years?
Healthcare systems have traditionally been laggards in technology. Yeah, we are called as the dinosaurs when it comes to technology adoption.
Very.
And two, three reasons to it. One, justifying it why is because you deal with human lives. In technology, there's a delete button. We don't have a delete button. Here, saying sorry means costing, lives or a complication. So that's why people are skeptical. Two, stemming from that skepticism, it is excessive skepticism, which leads almost up to
Yeah.
paranoia in healthcare, and hence they don't want to adapt any technology. Uh, I remember this thing, I was at a digital health forum, and the principal secretary working on the Ayushman Bharat ABDM and the digital health mission was there. And he said that we want ABDM to be like the UPI of healthcare. And in a room with a lot of doctors, in digital health, he literally joined hands and he said, we thought that bankers are difficult to deal with. You make them feel like angels for us. So that's the reputation doctors carry when it comes for technology and adoption at a systems level. Coming to where we will see it, right? The applications have started coming in day-to-day care. A large majority is in diagnostics, in screening,
Yeah, yeah,
where
yeah,
we
yeah.
see most applications for it. Preventive healthcare has never been a big forte, particularly on this side of the world. In healthcare, we don't really talk about prevention. It's always been curative to the extent that a lot of experts say that we should start calling it sick care and not healthcare. So that dimension will change. With all the screening tools and technologies coming in, preventive health will come in a big time. Till now, we used to get information. Today, with AI, the information gets converted to insight, and that insight just needs validation. And where we are stuck at is, between the good and the bad. Back when we were in school, we used to write essays like science, a boon or bane, and technology, a boon or bane, and we are still there. It's just that the topic has changed, evolved from just science or technology to now talking about artificial intelligence. There is a lot of scope for administrative burden to be reduced by artificial intelligence in healthcare. The West has started moving in that direction because they face more administrative challenges due to their age-old systems, the way it works. In India, we still have low EMR adoption, low utilization of technology on a day-to-day scale, and hence the administrative adoption of AI will take longer. Where I see maximum potential is in access. India is a country where access has been a challenge, and that can really be mitigated by AI to no leaps and bounds. Just today morning, the Times of India talks about how India has never ever been able to achieve the WHO standards of number of doctors per thousand population, and if we just keep changing it, we might be able to create more doctors with that seats, but I'm very skeptical about the quality with more and more seats just being thrown in without a lot of forethought. So access becomes the bigger playground for AI in India.
Hmm.
Precision AI becomes a very big thing. We have been always wondering, what exactly happens and what goes wrong and how it happens. Predictive healthcare, our ability to predict things in healthcare to not an astrology kind of gimmick, but more very data-based and very population health-centric. That will change the face of healthcare with AI trying to make us less sick and trying to play more on the preventive side and less on the clinical judgment side, but more on the insights and the predictive side of it. So that's where I look at AI changing.
Hmm. True. Very interesting. So then, if anyone among us wants to enter into a field which is healthcare, which is AI bounded, so do you think we should be harnessing or learning a few skills or anything else apart from what we are doing day to day? Like, apart from the way we use AI, the inputs, is there anything necessary apart from that too we should be knowing?
I think you know you must of course integrate AI into your day-to-day way. Improve your own prompting, improve your own way of how you are able to generate outputs. There is something called as meta prompting. Maybe try that on how to create a meta prompt. Create small agents, just for the hobby of it, for the fun of it. You are able to create various agents. You can create an agent to teach you your subject for MD. You can create an agent to help you do deep research on a seminar that you are working on, or help you with a lot of scientific writing or scouting stuff. Besides that, I think stay abreast with what is happening. You can ask AI to teach you or tell you what is happening in the latest domains of AI and understand where that is going. Two, you need to understand the AI market, not just understanding technology. And a lot of us want to just be subject matter experts. But if you want to be a subject matter expert without a business insight, without an understanding what the market or the potential looks like, you are not going to be doing very well. You'll end up just asking people like me every time if you put in a Q&A saying, tell me if there are any openings in this space or that space. It doesn't come, okay? And I will also want to point that out, that a lot of us, and maybe at the risk of sounding old now, that the current generation does want a lot of things on its platter, and people don't want to really scout for it, because I understand you are tired from all the entrance exams, you're tired from your departmental work, and you don't want to do anything extra. But without that desire to do anything extra, you will not get that opportunity to move from ordinary to extraordinary, even otherwise, right? That extra is what makes all the difference. So learn to do that, learn to gather insights, follow the right people. While you see a lot of trends and memes on Twitter, LinkedIn and other social media, try and follow people who talk about this domain. Try and follow doctors who talk about this domain, which can be more relatable to you. See where the business of AI is leading. What kind of startups are entering in this space, what kind of investments are happening and where. And don't be just healthcare centric. Of course, your focus should be healthcare, but you should understand an overall understanding of where these principles will go. Uh, Two is, don't look at it with skepticism. Don't look at it with something that's going to take away your job, or thinking that, oh, if AI is making things so easy for me, I might become redundant. No, that's not going to be the case. And on the other end of the spectrum, don't think of it as a magic wand. You can ask AI to create a strategy for you and give it, but it's not going to be any close to reality or human touch if you have not put in your effort either in feeding the prompt or in analyzing the output. So these days, people feel it's very easy to fool the world with AI, but I think human intelligence will always be smart enough, and intuition in human intelligence is going to be smart enough to figure out that you've just copy pasted AI. So utilize it for productivity, utilize it for boring tasks which you don't feel like doing, and just quickly work on it. But develop skills around by learning, by attending events maybe that happen in this space, and you just go for understanding what people are doing in this space rather than going there to listen lectures or collect a certificate. It's more about networking with the right set of people who are dealing with this domain if you like it. And to start off, where you have to start on this, I think you can there are many organizations which are looking for medical background people to validate things within AI on part-time and freelance basis. You can start there, and that interview also is taken by an AI agent. So I think you will get a very good flavor of where the world is heading. But you have to start and scout for yourself. If you start feeling that, people will create courses, right? It's a money-making business. Tomorrow, you and I will create a course, about all of this, and then charge you a good amount of money and come and tell you these same things more theoretically rather than in this real life way that I'm talking to you today in a couple of minutes. But so I'm sure they have their own value, but I believe a lot in the whole 70-20-10 kind of educational model, where 10% is only what you get through courses, 20% is through your peer network and networking and understanding from others in the domain, and 70% is on the job. So if you want all 100% to be squeezed in that 10% of a course, you are fooling yourself, nobody else.
True. I would like to ask you this, like, if we have to move forward, like right now during the residency, then after residency, and to a world of entrepreneurship, like these are like complete dimensions, totally correct. So at the beginning, post your residency, should we start with working in a industry, in any form of industry that you like? If we should start with the industry, I have two questions in this. First is, if we start with the industry, should we should we start working with a small startup and then move to a bigger MNC kind of place, or directly go to MNC? Anything that you would like, anything, the right ladder you tell for understanding how to go into a entrepreneurial setup, or should we directly start with the entrepreneurial, like, if we have an idea?
Right. So one course correction there, Abhilasha, I think, is you should start before your MD and not after your MD for anything that you want to do, because then you are late. I think last month I spoke at the MAMC Innovation Center. They've done a collaboration with IIT Delhi, and so they call it MIC or something, and they bring in people like us, of course, again, to talk about AI and different domains. They have a healthcare person and an IIT and talking about different domains. This collaboration should start very, very early. Yeah. And whether you want to do this domain or not, and if at all you are inclined towards doing something, start thinking about things or ideas that you may have or you may face, and discuss it with your technology peers. I'm sure we all have friends who are engineers or coders or data scientists. Collaborate. There are a lot of student activities and initiatives which a lot of these incubation centers and competitions are coming up with. Start in your MD and student days. You have time to do a lot of things. You have, because you're doing it without a thing of, this is my job, I have to do only this much, right? You're still a student in some way, and you're going to have that desire to do more. So you work in that domain and start early. You may not probably be, people then will come with the counter argument that we are not in a top institute like a MAMC or an AIMS to do this. Mm-hmm. Everybody can do it. Today it's very easy to find peers and find people, and you are able to really work on projects like these if you are able to show interest and inclination, but start early. One advantage of that is, one is you are able to put in more effort. Two is you will not be very affected if it fails. If this is the only thing you're then relying on post MD, you may be affected very severely if it doesn't work out, right? From a emotional
Yeah.
perspective as well as a financial perspective. So, hence, starting early is the key. Coming to whether you should join a startup first or whether you should join large companies first. Working on both domains and being on the hiring side also on all fronts, startups are always in a hiring crunch. They do not want to hire too much. They want to hire fresh talent for certain domains that they are looking at. One. Or they want to hire people who are experienced or have worked somewhere where they can add more insights and value to what they are building. Because if you are also fresh, the startup is also very fresh, then don't know who is contributing to who. So my suggestion generally is, if you are figuring it out, if you don't know whether you want to enter into a tech domain or a health tech different domain, or you want to do things differently, you may want to start with a stable or traditional career, because you will get exposed to a lot of things in that which you may probably not get or understand. The insights that you bring from that perspective of large corporates are more valuable to startups and other smaller organizations, because you have seen it from a different lens and now you bring all those learnings to them. Vice versa also helps, but the way it is evolving, so people who are probably in their first year and listening to this today, and when they pass out, it may change. There may be a lot of more startup ecosystem, then you may have more openings in that domain. Somebody who is passing out this year, things may not be the same. So you have to see what suits you the most. If you decide and you use the theory of elimination. Sometimes if you don't know the answer to an MCQ in your entrance, you say, okay, it can't be B, it can't be C, it has to be A or D. Let me figure out between the two. And the same works here. If you decide I don't want academia, I don't want a traditional industry role. Okay, then I'm willing to experiment, I'm willing to learn, I'm willing to take up roles in a startup, I'm willing to take up those domains and then see how to figure it out. If you feel that is not what you want to do and you are not very sure, I will say, if you're not sure, take up a traditional role. The reason why I say this is that if you're not passionate about entrepreneurship or passionate about very different things, there are going to be a lot of setbacks when you take up roles in startups or roles in smaller organizations or in tech spaces. And then you don't want to feel very dejected because you don't have a safety net. But if you are very passionate, this is the only thing I want to do and I want to build my mark here and this is where I want my career to go, I will not be bothered if I'm not paid for 3 months. I will not be bothered if I have to job hunt every 2 years. But this is what I want to do. This is what makes me happy. Then you can do it. But if you are figuring out that, I won't mind a role in technology, then please take up a traditional role. Because not minding a role there is very different from I want a role there, right? So don't get carried away by any person. Don't get carried away by anybody's trajectories. I always tell people that you mostly call outliers to talk on platforms like these, or outliers whose stories you will read about, because but you have to follow the bell curve. You cannot follow outliers on both sides. Either those who've done very well, nor those who may or may not have been successful yet. But you have to see what happens in the bell curve. We all do a lot of biostatistics. You understand what happens in that 95% interval, and you have to follow and understand that in this kind of a domain, this is what happened to 95% of the people. I may be an outlier, but you will know you're an outlier only if you enter the curve. That I'm not fitting here, so I'm going out. So don't start with at the outlier end of the curve. Be in the curve first.
Okay, rightly. Very eye-opening, but still. Okay. So, okay. We got the answer for what we should be doing. Now, what do you think should be the first step for pharmacologists, like for all of us, to be taken for, like most of us are of the opinion that we want to make an impact. Like we have stepped into it, now we need to have some impact of some value of at least not for many, but at least a group of people at least. So what do you think should be our first step towards it?
Collaboration. I think the first step you should do during your residency days is to understand collaboration. Collaboration with your clinical counterparts and peers to understand what are the gaps in their system, in their thinking, which will help you in all ways. If you join a traditional medical affairs role, you will know, how clinical people are thinking of certain domains, how you will help you devise your strategy. If you work in the clinical development and research, again you will understand all the bottlenecks of what happens in real time patient recruitment and trials, etc. So collaboration, not shying away from there, right? Two is again then collaboration with outsiders, which include either industry people, management people, or technology people. Start that attitude of collaboration and cross functional thinking very early on, because that is what is going to help you in many ways, right? We all want to create impact at scale. See, I tell people that the reason you take up this branch is because you want to create impact. You launch or work on the launch of a new drug, you are creating impact in millions of people. As a practicing clinician, you cannot see 1 million people in your lifetime. So it's about the scale at which you are doing things. Now the idea that you want to do it at scale, you are supposed to take efforts to build around it and see and how to make things work. What happens is we generally want things, in a very ready-made or a very or a fashion in which, okay, this is what I have to do, this is how I will do it.
Controlled atmosphere.
We shy away from taking that leap, taking, a bold step very early on and trying to see if it works or if it fails. Trying to go in different domains and putting yourself out there. I appreciate a lot of people. I think most people, if anybody's ever reached out to me, will know that I mostly always respond to people on LinkedIn. When they message, if they message in the right way. If you message me, please help me find a job, I will still reply, but I will not be very elaborative with my response. Or if you tell me what course should I do, those kind of questions don't work. But if you're trying to really, get into a group of people, talk to them, get ideas around how things are happening, and then see how you can collaborate and work on those things. Everything doesn't come as a listing or a job opening. Yeah, none of the things I did during my MD days were advertised on LinkedIn or advertised as a job opening. It doesn't happen that way. You need to talk to people. You need to reach out to people and ask them, is there something I can contribute in this way, and what can you bring to the table, rather than asking them what job or project will you give me. You need it, right? You are supposed to say what will you bring to the table rather than what they should offer you. So when you do things like these is when it changes, is when you understand. See, it may work for you, may not work for you, right? You may start off with that. You may probably collaborate with your friend in IIT and develop a product which probably nobody buys. Fine, you learnt it. You've got immeasurable skills which probably an MBA wouldn't have taught you, or 10 years of a job wouldn't teach you. But then you ended up then doing a day job in the industry, which is fine. You should not have any regrets, is what I feel. And that's been the motto of my career choices, right? That I don't want to regret later in life that, hey, I wish I would have done that. No, I wished I did it. I didn't do well at it. It didn't work out. Fine. I have my safety net to go back to. So people should start with that rather than saying, oh, this is what I will do, I am exam going, so I only have to study. Please don't fool me. Don't fool anybody. You have a big prep leave in which you end up studying and you're going to still be able to pass. People take 1 or 2 departmental activities so seriously as if it's the end of the world. And then you have, even if you do nothing, you have 8 to 9 hours in the department. You have tons of things which you can do there. Tons of things you can learn there. But you don't end up doing. You end up being in your own shell, either because of your own insecurities, either because of whatever varied reasons that people may have, and to each their own. I'm not saying everybody has to go out there and do something. But people who are desirous of doing something, don't sit back and wait for people to come and reach out to you saying, oh, wow, Abhilasha is a brilliant student in some medical college and now I need her help for my startup. That's not going to happen. You cannot fool yourself that way. So start creating opportunities, like what you all have done, like a group of people gathered to create an initiative like this about Decode MD. I think it's brilliant, it's phenomenal. I feel, why am I not born in that era where I could have done this? I knew a ton of people whom I could have invited and done something like this, but I didn't. So I appreciate that kind of an idea, that people can get together and do such things. Today technology helps you connect with people across the world, so make the most of it.
It's very humble of you to mention us here, but yeah. But thank you so much for this. It's like it was very much necessary for a lot of us to listen to this. It's very important to know that what is to be done, what are the first steps to be taken. It's very important because we, lot of times, I think we, all of us have some kind of inertia into us. We know that we have inertia, but we don't try to get out of it unless and until there's an eye-opening person around us who's just hitting onto your head and saying, bro, this is not going to work for you for a very long time. You need to get out of it. Yeah. Thank you so much for this again. So you have mentored a lot of people, like you must have mentored a lot of them until now. Like you said, you do TED Talk, and also you have talks into multiple different colleges, and also probably in conferences and everywhere also. So the Gisa Pita Sawal it is, sorry for that. What is that one advice you repeat for everyone, like the newcomers, the ones that have just learned into swimming, and the pros also? One advice you would repeat for everyone?
I tell people, one is, you have to understand where passion meets practicality, and where ambition meets reality. So people enter, the younger ones enter with a lot of passion sometimes, without figuring out whether this is a practical thing to do or not. Like you asked, should we just jump into a startup? And then they don't know that if it doesn't work in a year or two, I will be jobless, or I may not get a salary for 6 months. You are very excited about things when you start, because you've just passed out, you're still not running behind a pay package, and you will be excited. But then when that shortfall comes, you don't know. So I always tell people, it's open to jump into a well, jump into a sea. Know the depth of it. Know that there's a shark inside. Know that there's an alligator inside that can eat me up. There is no harm in jumping into a water where there is an alligator. But provided you know that the worst thing that can happen is that the alligator will eat me up. People jumping into it without knowing it, saying, oh wow, it's a beautiful day, it's a nice day, let me get into a leisurely swim. That's not how you deal with life choices and career choices, right? It's not leisure. And that's one thing I tell people. People who are experienced sometimes run a lot behind ambition. Run behind a fancy title, run behind fancy names, and not understand whether this is actually serving my purpose or not serving the purpose. So as you evolve into career, everybody has different challenges that they face in life, just like we have with life, right? When you are a kid, you want to grow up, your biggest pressure is an exam, then it's a job hunt, then it's a promotion, right? And then it is mental peace. so it's the same process that goes in. That's what I mostly tell my mentors and the mentees, that this is what you must do. And what I said earlier also, that nobody's going to serve you anything on a platter. You need to get up and work for it. You are not going to get ready-made answers from me. You need to figure out things on your own.
प्यासा कुएं के पास जाता है, कुआं नहीं आएगा प्यासे के पास. Is that what you conclude?
So Pyasa has come, but then Pyasa doesn't know how to. Pyasa wants the kuwa to keep a glass, keep filtered water, keep everything ready. That now the kuwa is not where they want to.
Is it for the Gen
Get the water. They want the water to be served perfectly well for them. Even eventually, it might even end up with a straw and directly put it on their mouth. So
there's a newer term to it. They want a metal straw now.
They are Stanley cups.
Okay, very rightly said though. Okay, now we'll move forward with the questions associated with how do you see the future of pharmacology in coming times. Okay, the thing that I would like to ask you is, what do you think we in we pharmacologists have bigger opportunities like in coming time? Where do you think the next bigger opportunity lies into? What avenue does it lie into?
I think with the way technology is shaping up, there will be a lot of regulatory need of tech companies having to move from consumer tech to medical grade technology. Right? Everything is moving there. We are working with smart rings today, smart devices, which all want to be medical grade. Globally, to become anything, to become medical grade, you need to go through trials, you need to go through a lot of things. Those are, I think, very big avenues across the world. Even Indian regulatory landscape is evolving, and that's where I think a lot of new scope comes in. So people who are interested in research, who are interested in clinical trials, but also interested in technology and devices, etc. That's a big avenue which is going to come up, because you are now going to want people to do that. Two will be designing within research, right, where decentralized trials, a lot of new activities come in, wherein you have different trial designs, different elements which will utilize artificial intelligence and technology, and your role there will evolve. Three is designing the regulatory landscape for it. So, no ethical AI, use of it, compliance within AI for healthcare are again roles and opportunities which will evolve. Today, we may not have such roles, but these kind of roles and opportunities will evolve a lot. So people need to stay broad on what kind of things are they now looking at. They may not ask MD in pharmacology as a requisite in your job description, maybe. They might be okay with people starting out with MBBS or starting out with any other healthcare domain also. But these kind of roles definitely will evolve. There are also roles within insurance landscapes which a lot of people don't look at. But I see a lot of new age insurance companies which work with technology, who now want medicos to design programs which are going to help patients in preventive health care. So insurance companies want to design, preventive health programs which they want to give all their policy holders and things like that. So imagine all those roles which are there. The problem is, like you started off this conversation thinking, that people come with a fixed mindset that these are 3 or 4 things that you can do, and they don't see all these opportunities which lie open to medicos. And you are a medico, everything applies to you. So these domains will definitely evolve in the horizon of the next 5 to 10 years. I'm not saying it will happen today and tomorrow. Globally, it happens a lot. If you're the kind of roles, I think I will urge people to maybe once look up on roles which happen for Google Health. The kind of roles that are there, the way it works, you will be fascinated. You will really want to work in a domain like that. So look up such kind of roles. NHS is working on roles like that with digital health. People have started digital health wings in all of the regulatory bodies. So there are going to be tons of roles, provided how you make yourself fit for the role. So how you make yourself fit for the role, as freshers, of course, it's very difficult to be fit for everything. But look at all these job descriptions, see what kind of skills they ask for, see what kind of skills you have and what you can learn, so you can be ready for those roles.
Yeah. Oh, very nice. Lot of new things. So, with AI advent, then there is digital therapeutics, and there is precision medicine. Do you think we will be taking up pharmacology to next level slowly, or fast? Also, I think it will be more
I
faster with these.
I think, see, the onus of it is on the people doing it. For an entire branch to evolve, to go to the next level, you need the 80-20 principle, right? At either end, you either need 80% of the people doing those kind of different domains, or you need those 20% outliers to move the branch to move the remaining 80% in that split, right? The latter being more likely.
Yeah,
But
yeah.
you you cannot work thinking that this is going to evolve for a branch, or what I did is going to change the face of a branch in particular. The world does not tag you and classify you as, say, you have done an MD in this and people doing an MD in this are doing this, so they are the great ones. No, it doesn't work that way, right? Till you probably, because of a broken system that we have, that singular ranks decide where each branch lies in the whole hierarchy of things, is not how real world operates. That's only how
Yeah.
your entrance exams and admissions operate. The real world doesn't operate from a branch lens perspective. What it looks at are people with those skills. You are not going to They're not going to hire you because you have a given degree only, or because all these things have come up. Saying that, it's akin to saying that every engineer now will feel that we should be paid 10x because AI is coming and everything will be with AI. That doesn't happen, right? It's only the select few who will always get through. But the same thing is, these things open more avenues for the branch, because now you are able to explore into more non-clinical or paraclinical kind of roles where you have more activities to do, more initiatives that you can be a part of, and more companies that are working in this space, right? Which may not apply to a lot of people because they are unaware. A surgeon is so busy in their own things that they are doing, or so busy trying to upskill or run their practice, that they're not going to see other domains. The advantage of this branch is that you are the only branch that has the opportunity to see the world from a very broad lens. And what hurts me is that people don't do that. They have the broadest view of the horizon. You have a 360 view. You are on the top of the biggest tower to see everything around you. And yet you feel, oh, I'll have to take a lift down. Your problems are very different, right? Or you don't realize that I can turn around also and look. For others, they don't have that opportunity. They don't have the luxury to have a 360-degree vision. So for a branch to evolve, it can definitely happen. But we need more people who are going to take up different opportunities, who are going to make their mark wherever they go. The moment they make a mark where they're going is where you will see a lot of things changing. If a particular person is making a mark, then their background is also making a mark. That, oh, this is from where they passed out, this is the degree they held, these are the past roles they held. But that is not going to come overnight. People look at it the other way around. They think it's a pedestal. I put myself on a degree, everything should now, rise by itself. It doesn't work that way.
Um, going through all of this, during the residency, like going to the core of our where we start pharmacology with, do you think there is some need in the change of the curriculum that is being followed for decades together? Like, we have changes in the book though, and even if we talk today, they might not give a impact of the, it might not also, we don't know, but then still I would like to ask you this: do you think there is some change in the curriculum that is needed to be made?
See, I sometimes believe it's easier to change yourself than change the world. You cannot put a carpet on the earth, so you wear shoes. But
Yeah.
that's where my understanding is. I have never been a very strong proponent of rebellion in terms of curriculum change and doing that. There are a lot of things within your curricular activities which prepare you if you take it in the right way. Journal clubs, for example. If you are able to really decipher it, bring novelty into it, see how you dissect a study, choose the right things, use that to learn study designs, use that to learn different domains, use that to then create a letter to the editor and write to them. You are able to do a lot of things. If you are able to apply technology and create something wonderful in your seminars, you are able to do a lot of things. You are able to do a lot of things when you are able to teach. I used to start my lectures by telling people that I wanted to do stand-up comedy, but doesn't pay me as well as medicine, so I became a doctor. But and that's why I'm going to, bore you with stand-up comedy and lame jokes throughout the lecture. But you can bring innovation every time because your students are not going to judge you, and even if they do, you care a damn, right? So you can bring innovation that way. That uplifts your presentation skills, your soft skills, your innovation skills on designing new educational curricula. Why can't you bring that change by yourself rather than asking them to change the curriculum. What do you need extra? You want industry posting, maybe. Some colleges may allow, some may not allow, right? If they're not allowing you to do it, talk to industry people, bring your own alumni to maybe have a candid conversation with you all in college, on a Saturday. Just call them. I'm sure most of them will be happy to come. Provided their schedules permit, I don't think anybody will say no to come to their alma mater and talk for an hour to all of y'all, where you will understand all different domains of the industry. Why, what else do you want? You want to learn something on AI and technology? Look up, there are online Coursera free courses. Why can't you all residents gather and decide that, every Thursday we'll see one lecture of Coursera together in our seminar hall and learn, or everybody learn one topic and teach each other. You can learn that. Why do you want an overhaul at a systemic level, ruffling everything? For doing what? Eventually, what do you want the curriculum to do to you? Want to train you for all possible roles and possibilities that are there, right? You can do it yourself. Why do you need a dictated curriculum coming from an industry, from the university to tell you to do it? I don't understand why you need it.
Okay. Like this is like a very different answer we've gotten until now. I would like to tell you that first. But it was very rightly said though. I mean, yeah, why do you need it? But it's just at times people जो लातों की भूत बातों से नहीं बांधते
It's
types.
it's more
But then
about
after,
it's
as you
more
have
about an
told before,
excuse. I will put it very bluntly. It's more about hiding behind a shield. That our curriculum is not evolved, hence we are not evolved. So
yeah,
fine, be it.
maybe we need one more reason to tell also that why we did not do things
Yes,
during our residency.
it's a shield.
Okay, now, like from what we could see, pharmacology and everything, I would like to have some personal insights about from your end also. Like, what is your reflection about everything? How do you see through things? So, you have done a lot of impactful initiatives. Like before starting a conversation, I have told about you, like how you did it, how you started from residency, then working to different people, then starting your own startup. Like how did you go through all of it? Is there any one project that actually inspired you, like that one hit onto your head, like oh my god? So, was there any such one project, or was it just
I think, like I said earlier, also a lot of it is serendipity. A lot of things happened that way, and it's not that I had always planned it in one domain. One led to the other, and I think every experience has taught me different things in many different ways. Uh, what impacted or changed my vision or understanding, I think, was the biocamp. I owe a lot to that. So, Novartis used to do that as an activity for students, and it was my first non-medico cross-functional interaction. So, out of thousands of students, through 3-4 rounds, 50 are chosen for their Hyderabad campus, and it's a mixed blend of a few MDs, medics, most MBAs from tier top institutes, and few lawyers and patent specialists, and few researchers, PhDs in India. So top 50, and then there is another competition there, and then 3 of them are selected to represent the country at the global one, which happens at the Switzerland, the Basel headquarters. So I think that changed a lot of trajectory for me, because it was the first exposure that I had working in a cross-functional team. Industry kind of exposure of what people actually do. And then seeing that from a small team level to then seeing it at how it happens at the global scale. So 4 days in India and then the 4 days in Basel, I think those 8 days taught me more than the 3 years of residency probably, and more than the first 2-3 years of my early days of my career as well. It was that intense. I think that that changed my entire understanding of the industry, the horizon, and the scale at which things happen. Seeing world leaders, seeing how they do, emulating how they talk, how they do fireside chats, how they interact with students, how they interact with others, taught me a lot about leadership and many domains. So I think that was one very eventful turn in my career that changed a lot of things for me. Rest everything's, I think, just happened by itself.
Very, very well said, though. Now, like, I would like to move forward and ask you that apart from all of these insightful projects and everything happening around, do you think there was something, some one belief that kept you anchored through all of this, like so many changes happening around?
Uh, One belief I think was always about, trying something new. I've had this kida to always keep doing something new all the time. And what kept me going in a way is, we'll see when it comes. I always wanted to take the road less traveled, and I know that it comes with its own set of challenges. So what kept me going is that understanding, taking each challenge in my stride and taking it as a learning, that things may work and may not work, but I want to try. There is you will not know till you don't try. And I relied on those principles, and like I said earlier, that when opportunity comes, I generally say an yes. So things came my way, I said an yes, and I said I'll figure it out on the way. So I think one belief which everybody can keep is the fact that we struggled a lot in our lives to reach to this degree, in its own right. We've been struggling from childhood to have the longest educational curriculum, the toughest of entrance exams, and the rigor of all your vivas and all the, again, not so great working environments also in medical colleges. You have gone through so much. So if you were able to achieve all of that, if you're able to prepare 19 subjects for an entrance exam for 2 hours, you can definitely learn anything that happens on the job. It's not going to be that challenging. So I always look at it that we've moved mountains, everything else
Yeah,
now is
yeah,
going to
yeah.
be smaller. So that's the principle I think we can all follow.
Yeah, thank you so much. Like I would like to put it in a right words actually. Thank you so much for inspiring us so much today. It was so good talking to you through all of this. And right from where should we start? How should we do it? As you said it before though too, that even if you have everything set onto your platter today, if you want to have an extra impact, if you have want to have some extra thing, there is one, or take at least one step. You might have to walk a mile ahead though, but you have to take that one step at least to get out of this everything. Am I right?
Absolutely. That's right. It's always the first step.
Okay, we will be signing off now for today. Before
Thank
that,
you
I
so
will
much.
thank you so much for everything. Thank you so much for giving us so much time.
My pleasure, and thank you so
So,
much for the opportunity for me to express my feelings here, and great candid conversation with a very different set of questions rather than the usual stereotype scripts. I think I like that part a lot. So very natural, very candid, and I hope the message reaches to the intended audience that you
we hope that too. We want a lot of people to get to what is pharmacology and how to go through it. Not just this, a lot of different questions too.
sure.
So, thank you so much, everyone. Today, Dr. Abhilasha is signing off through Decode MD. Before that, I would like to say like, share, and subscribe. Thank you so much.
Thank you.